Hello and good morning everyone, and special greetings to our listeners from outside of Canada and US. That would be Chile, Slovenia, England, Puerto Rico and Ireland. Welcome to our web show, It's All in Your Head. My name is Rita and I'm here with Dr. Paul Swingle today to talk about sound health products. We are going to review some of these products and explain how they are being effectively used when dealing with brain conditions. Sound Health Products Company has a range of neurotherapy, biofeedback and sound healing products. These products are designed to modify brain and physiological functioning using biofeedback and neurotherapy techniques for the treatment of neurological conditions, including depression, attention deficit disorder, hyperactivity problems, anxiety, sleep problems, phobia, and addiction disorders. All products have been researched and subjected to stringent quality control. Sound Health Products creator, neurotherapist, and biofeedback expert Dr. Paul Swingle was titular full professor of psychology at the University of Ottawa prior to moving to Vancouver. Fellow of the Canadian Psychological Association, Dr. Swingle was lecturer in psychiatry at Harvard Medical School, attending psychologist at McLean's Hospital in Boston, where he also was coordinator of the Clinical Psychophysiology Service. Dr. Swingle is registered psychologist in British Columbia, certified in biofeedback and neurotherapy. His newest book, Biofeedback for the Brain, was published by Rutgers University Press, and it is available at soundhealthproducts.com. Okay, you are welcome to send us questions during our web show. We will have 2 Q&A breaks to go over these questions, so do not hesitate to send them to me. You can do so by using the chat box located on the control panel. Well, it looks like we are ready to get the show started here, so let me welcome Dr. Paul Swingle. Good morning.
Good morning. Well, today we're talking about home treatment procedures.
I don't hear him.
Given that
No, he's unmuted.
data indicate that about 1 in 5 people in North America are on psychotropic medication, you can just imagine.
I'm sorry, I'm going to jump in. Could anybody please send me a message whether you can hear Dr. Swingle? Because it seems that I have difficulty hearing him. If anybody can let me know. Yeah, now it seems good.
How's that?
Yes, yes.
Okay. Technical problem solved. As I was saying, about 1 in 5 individuals in North America is on some form of prescribed psychotropic medication. You can just imagine how many of us are taking some kind of home treatment product, usually supplements. And what we're going to be doing today is looking at some of the data associated with what we are all trying to do to keep ourselves in good and excellent health. Well, the thrust of this presentation is going to be that by and large you want to minimize how many self-help products that you're using. For example, this was just published. This was published in the Journal of Holistic Health. In terms of stress control, you can see that normalization of salivary cortisol. Now, cortisol is a stress hormone. Is modulated by a brief lunchtime visit to an art gallery. Okay, I think going to an art gallery is a lot better than taking some sort of supplement. Follow your grandma's advice. Go to bed, get your lazy duff out of bed, and get your lazy duff off the sofa. In other words, good sleep hygiene is a game changer. If you're able to get yourself into a state in which you have perfect architecture sleep, meaning by that your sleep cycle is regular, you're getting about an hour of deep wave sleep and about 2 hours of REM, then you're going to be in good shape. Sure, formula for disaster is sitting on a sofa eating potato chips and watching TV. Bad news, particularly for people in my age group. And remember the wisdom of the camel driver. Now, we have a lot of recent interest in conditions such as awareness training, the power of now, and so forth. This is simply the advice of the camel driver and Paulo Coelho's The Alchemist. Live in the present, not in the past or the future. And his comment is, life will be a party for you, a grand festival, because life is the moment we're living in right now. Okay. Now what this is all pointing to is that you have a lot of control over your psychological state and your physical state if you take responsibility for it. Excessive sleep, again, very problematic. Excessive sleep is associated with depression. It's associated with poor cognitive processing. The older you get, the more serious the problem. Exercise, big issue. And it's hard to say too much about the positive benefit of regular exercise. It affects the neurochemicals in the brain, neurotransmitters in the brain. It influences immune system, maintains good core body temperature, affects your mental state. Antidepressants, as I just pointed out, about 1 in 5 adults in the United States, probably equally true here in Canada, is taking at least one psychiatric drug. That's we're dealing with an epidemic. But what's interesting here is the comment made by the research head of one of the very large pharmaceutical companies talking about placebo drugs. The placebos have a massive impact in lifting depression. Now, we have a lot of data on that. And he points out that the difference between an active psychoactive drug is only about 5% different from an actual placebo. And it's interesting. I really like this. Eli Lilly, the big drug company, spokesman Gilles France, all placebos are not the same. I love that quote. So if you give somebody a placebo that's green and fancy shaped and prescribed by a physician, it's much more efficacious than a plain old white sugar pill. And the pizzazz associated with the presentation, for example, sham acupuncture is more efficacious than sham pharmaceuticals. So all of this is designed to simply call to mind the problem associated with what I call the silver bullet syndrome. There's very little convincing evidence for any benefit from supplements. There are a few. If you eat properly, sleep properly, exercise properly, and treat the cause, not the symptoms of the illness, and use your head. And in fact, some supplements have found to be harmful. Now, a lot of this has to do with politics, has very little to do with science. Okay, now, we're going to be looking at data. That is, what evidence do we have that any kind of supplement or home treatment procedure has merit? That is, are there data behind it that suggests its efficacy? And a lot of this has to do with the quality of the data associated with testing the various home treatment procedures, whether they're supplements or mental exercises and so forth. In the book, Do You Believe in Magic? He points out that there are about 58,000 supplements on the market, of which 7 or 8 have data that would be acceptable in terms of efficacy. Overwhelmingly, most supplements and most home treatment products, the only data available are testimonials. Now, testimonial data is absolutely worthless. If you look at the effects of placebo, whatever an individual takes with some degree of positive expectation, you're going to have a large number of individuals who will feel better. Now, what you're doing then is you are making use of a supplement for its placebo value. And I have nothing against placebo. I think that it simply indicates that if we focus our attention on our expectation for improvement, then we're going to feel better. Now, the question is, above and beyond placebo, what is the product providing to enhance one's well-being? So we can simply dismiss testimonial data. And the second is subjective outcome. Now, subjective outcome is a bit better than testimonial because if it's done properly, that is, if it's done in an objective manner in which you give some individuals a sham treatment, placebo, and you give other individuals a treatment that is one that has the presumptive effective element or component, and you ask individuals how they feel at the end of some treatment course. If you have more individuals who indicate that they feel better, are better, or have some demonstrative evidence of improvement, then, excuse me, you can conclude that whatever it is you've added has some merit. A lot of this we refer to as horse race methodology, in which you line up the products, give some folks product A, some folks product B, then you look at which one crosses the finish line, having greater subjective evaluation, that is more positive evaluation of outcome. Sham horse race is basically you have a treatment in which you can have a sham condition that's not identifiable by the person using it. So sham acupuncture, for example, if you're using needles, you put the needle in the actual acupuncture point on the meridian, and the other needle you put in the same depth and so forth, but not at an actual acupuncture point. This is easier to do with electrical stimulation, which is what we tend to use in the Swingle Clinic, in which you can adjust the stimulation so the person can actually feel the stimulation. And in some cases there is stimulation, and in other cases there isn't, but it feels the same to the client. And the data that is most reliable and valid, of course, are data that address the putative mechanism of whatever disorder that you're dealing with. So that if there's a chemical imbalance somewhere in the body, either in terms of measurable nutrients or enzymes or whatever it is, and you can demonstrate that there's a change in those data, and then you have demonstrated that the presumptive putative system or mechanism has been affected by the product. Now, we're going to be primarily talking about brain activity, and one of the measures of efficacy in the brain are brain waves. We have brain waves coming from the surface electrodes using an electroencephalograph, and delta very slow waves, something of the order of 2 cycles a second, which is what you're looking at here on the top. And you want to have some delta in some areas and less in other areas. And if you have too much in some areas, sometimes that's associated with a head injury or dementias, for example. Theta waves, a little faster, but still considered a slow wave in the brain, look something like this, in which you have between about 3 and 7 cycles a second. And here you can see the theta waves are the undulations, and the faster ones over the theta waves are the faster beta waves. Okay. Alpha waves, more sinusoidal generally, and they look something like this, and they're at about 8 to 12 cycles a second. And beta is a much faster wave, something of the order of 16 to 25 cycles a second. Now, what do I mean by a putative system? Here are brain waves, measurements of a child with hyperactive condition. So this child has been diagnosed with ADHD, attention deficit hyperactive disorder. Now, the low frequency is the theta, and you can see the strength or amplitude of theta in the hyperactive child is quite a bit larger. That is, the amplitude is higher when compared with a child without that condition. Now, if you look at very high frequency, you see the reverse condition. That is, the amplitude, that is the strength of the high frequency activity is quite a bit stronger in the child without the condition relative to the child with the condition. Now, the reason the child is hyperactive is because of the elevated slow frequency up over the motor area in the brain. The motor area of the brain is hypoactive, underactive, and what the child is doing is self-medicating. That is, the child bouncing around and very active to increase the stimulation in this area that's understimulated because of the elevated slow frequency. So it's difficult for us to really appreciate that sitting still is painful for a hyperactive child. That's why they're bouncing around. Now, you can use a medication for this, something like methylphenidate, Ritalin, for example, which is a central nervous system stimulant. And what Ritalin is doing is it's decreasing the amplitude of the slow frequencies, increasing the amplitude of the fast frequencies. And what that gives rise to is the reduction in the child's need to move. But there are other ways of doing that, and those are some of the products that we're going to be talking about in terms of their modifying measurable brain activity. So what we were just looking at here is the activity over what's called the sensory motor cortex, and that's running right across the top of the head. Right across the top of the head is the sensory motor cortex, and that's where we measure that activity that I just showed you. Can brain waves be modified? Now, can they be modified? We know they can be modified chemically. I mean, if you go out and drink a lot of alcohol, you're going to get drunk, and what's going to be measurable in terms of change in brain activity, obviously. The question is, are there methods for altering brain activity that, in the case of the hyperactive child, would reduce the amplitude of that slow frequency, in turn reducing the need for the child to bounce around? So this is some data from studies that were done at McGill University in the 1940s. What you're looking at here is a recording of alpha. That's the black on the bottom. Those are the waveforms. The S refers to sound, so that when there's that blip, the sound was turned on, and the bottom line marked L is light. Now, when you turn on sound, you don't get any particular change in alpha activity. And here, and what they are showing is turning on light. Okay? Now, light is an alpha suppressant. That is, it reduces the general amplitude of alpha. And you can see that happens. As soon as the light turns on, you get a reduction in the intensity of the alpha wave. Now, the question is, can this be conditioned? That is, if you pair the light with the sound, will the sound acquire the ability to suppress alpha? Now, many of you will remember Ivan Pavlov and his dogs, in which he demonstrated that you could condition the salivation of a dog to a bell if you paired it with meat powder. And here's the demonstration of that. On trial 9, what they did was turn on just the sound after having paired it with the light for the previous 8 sessions or so, and you can see that sound acquires the ability to suppress that alpha activity. Now, enhanced slow frequency is the putative system associated with hyperactivity. Can we find a product that will suppress the slow frequency associated with the child's hyperactivity? So that's the way we research these products, to demonstrate that it's affecting the putative system associated with whatever the symptoms are. This is just another demonstration of a mechanism for suppressing alpha based on conditioning. And if you present beats, that is, beat frequencies subliminally, what happens to the arousal of the individual? Now, we're measuring arousal with heart rate. And here we're presenting subliminal signals at 25 cycles a second, 15 cycles a second, 8, 5, and 2. Now, what we have demonstrated is that you can reduce heart rate with the faster frequency signal. It increases heart rate, that is, it's a stimulant at the lower frequencies. This is exactly the reverse of what we expected to find, by the way. We expected the fast frequencies to arouse and the lower frequencies to quiet. And what we found, and we've replicated this dozens of times, is that subliminal processing is very different than if you can hear the signal. And this is what it looks like in terms of efficaciousness of the subliminal signals. So what we're seeing here is that at about 25 decibels below hearing threshold, or ambience, I should say, that is the amount of sound in the room, you get a blip, that is a high point on the curve, and you also get one at minus 15. And we were curious about this, so we looked at males and females, and here's what we found. Females are more affected by the subliminal signal at minus 25 decibels, that is 25 decibels below what you can measure at the general sound level of the room. Males are at a higher level, minus 15 dB. So we can be very precise about the efficacy and precision of the signals that we're using to modify brain activity. We're going to be showing you the effect of some of these products at various levels in the brain. Here's the sensory motor cortex that we were talking about earlier, of the hyperactive child. So excessive slow frequency there gives rise to hyperactivity. We're also going to be looking at depression, and the culprits in depression have to do with brain activity in the front part of the brain. Quieting tends to be associated with brain activity in the back of the brain.
Thank you, Dr. Swingle. This is our first Q&A break, and we do have a few questions here. Somebody would like to know, what about the ADD without the hyperactivity? I think this is when you were talking about the effects of sound on the ADHD. So I believe this person would like to know, what about the ADD?
Yes. The difference between some forms of ADD and ADHD have to do with the amplitude, that is the amount of slow frequency. If you have a lower level of excess slow frequency, that's the inattentive type of ADD, the child that's always daydreaming. When the amount of that slow frequency gets large, much larger, that's when there's severe hypoactivity of the sensory-motor strip, and that's what gives rise to the hyperactivity. Now, there are several forms of ADD. There's another form of ADD that's more strongly related to addiction later in life. And that form of ADD has to do with excess amount of fast frequency in the back part of the brain. The hyperactivity there has a different putative mechanism, and when that area of the brain is affected, that's when you're more likely to get the ADHD, and anomalies in that area of the brain are much less likely to be associated with the inattentive form of ADD. So that's why the products that we are using for these things have to be associated with the actual brain activity, and we have to measure and be sure that what we're doing, what we're affecting, is the actual brain activity or the putative mechanism associated with the attention problem.
Thank you, and we do have another question. First, I want to say thank you for these fantastic monthly webcasts. I'm curious about low-dose aspirin. You said there was little evidence for effectiveness of supplements. What about the aspirin?
Aspirin's a little different. Now, remember, we're talking about supplements here, not treatment for a condition. Now, aspirin, the problem with low-dose aspirin, and we're talking about the low-dose 81 milligram, if it's prescribed by your physician, typically they prescribe it when you have had some heart complication. And there, the blood-thinning properties of the aspirin have been shown to be efficacious for reducing the risk of a second coronary event. The data associated with people just deciding that taking low-dose aspirin would be a good idea is not compelling. There's not any good evidence to indicate that it will prevent a first episode. Now, there are other complications. A recent article that just came out in the Pharmacology, the Brown University Psychopharmacology Review, indicates that things like low-dose aspirin can interfere with some of the other active drugs, in particular valproic acid, often used not only for seizure problems but also in psychosis, but also in terms of olanzapine. It was affecting the metabolism so that they were requiring higher and higher levels of this drug. This was in a schizophrenic patient. Because the patient was taking low-dose aspirin, again, on the assumption that it would prevent cardiac complications. So I think the message here is the supplements are not benign. And the difference between taking a supplement as a preventative under your own direction and taking it under a physician's direction, for example, is the difference between treatment and yourself medicating to try to prevent some sort of condition. I think the message here is nothing is benign, and you want to have a hard look at what the evidence is associated with its use.
I meditate every day. I think it helps. What is your opinion?
Good idea.
Great. And we do have time for one more question. Again, we are going to have a second Q&A break a little later, so if you do have more questions, send them over. The last question for now is, I was looking at two of your CDs, Omni and Attention. I'm a little confused about the difference between the two. They seem to me that they are doing the same thing. Is that right?
Omni is the latest generation of the theta active harmonics that we use. Attention has 4 different tracks on it. Now you remember I just showed you a graph on the difference between male and female effectiveness of subliminals. The attention harmonic has a track for males and a track for females. The Omni harmonic, as the name implies, is all-inclusive. So we have tracks in there for females, tracks in there for males that are playing simultaneously. When we have, in general, we use Omni for all of the conditions associated with trying to modify slow frequency amplitude. When we run into a situation in which somebody seems to be somewhat resistant to the effectiveness of these harmonics, that's when we get more precise and use something like Attention. Attention has a cut for the elderly, a cut for the hard of hearing, a cut for males, specifically males and specifically females.
Thank you, Dr. Swingle. We are going to move on now.
Okay. We were just talking about this guy. For clinicians in the audience, if you want to learn about the subliminal procedures that we're using, the clinician's guide gives a lot of information on how these products are actually constructed. I'm not a big believer in testimonials, as I've just said. They don't tell us really anything, but I like to get them nonetheless. And I love this one. This was on a very early version of Omni when we were still using tapes. And tapes are very, very efficient in terms of the analog properties of the signal. But in any event, our problem was that we only ordered 2 tapes. The 2 teachers who had the most immediate and dramatic results with their students would not loan their tapes for the rest of the staff. I love that. Okay, now remember the putative system we were talking about before in terms of the hyperactive child having excessive amount of slow frequency amplitude. The strength of this waveform is just too great over the sensory motor strip. So here's the presentation of one of the harmonics embedded within Omni. And here's the suppression of theta. And what this is indicating is just using 18 to 22-year-old females without any diagnostic category, just volunteers. On average, what we're getting is about 13% suppression, reduction in the strength of that waveform. These are adult ADD, and what we're getting is about 24% suppression, reduction in the amplitude of that waveform. Child ADD, about 15% reduction, and 30% reduction for individuals with closed head injury. Now, traumatic brain injury often gives rise to excessive slow frequency over the sensory motor strip, which is why you get motor complications very often with traumatic brain injury. This is specifically for an adult population, and this is what it looks like. So you get a lot of variation here. It goes from a low of about 4% suppression to a high of, I think it was 33% suppression. So there's some variability, of course, in terms of the efficacy of this for a specific person. But in all cases, we get a reduction. This is for children. And it's anywhere, again, from roughly 5% up to a high of 42% or so suppression of that slow frequency. So here's a non-pharmaceutical, a non-chemical that is demonstrated to be efficacious for the putative mechanism associated with that hyperactivity. Now, remember the brain map that I showed you showing all of those points on the brain where we measure brain activity. This is demonstrating that the suppression harmonic, the omniharmonic, is suppressing theta amplitude, and it's doing it over the entire brain. Here's the middle of the brain, right? It's in the center on the top of the head. Here's the front part of the brain, and here's the back of the brain. So we're getting a suppression, in this case quite large, in the range of 20% or so, suppression all over the brain with the when people listen to that omniharmonic. Now you'll notice if when I showed you the difference between older and younger people, that there seemed to be greater effect for older individuals. So we did a study on this, and that's what we found. Individuals over 18 years of age, 18 and over, the average suppression was roughly 30%. And for individuals below the age of 18, the average was a bit over 15%. So there is an age-related factor here. And again, this was counterintuitive. I expected the major effect to be on children, not adults, but it's clearly the other way around. If you only use Omni and nothing else, what kind of effect do we have? So the question here is Omni a treatment, or is Omni a maintenance product? So an individual who we have treated in the clinic using neurotherapy to reduce that excessive slow frequency, and then we have them use Omni at home to maintain the gains. That's one use of Omni. The other use of Omni is, do you get any cumulative improvement by using Omni as a home treatment? The answer to that is yes. Here is the suppression of slow frequency amplitude over the course of 8 weeks, when the only thing the child was doing was using Omni when they were doing their homework. So you get an increase, a benefit of about a half a microvolt a week over the course of this 8-week period. So it is a treatment in and of itself, above and beyond its properties for maintaining benefit of neurotherapy. This is some data that the late John Budzinski sent to me about his testing of our product, and what we get is an improvement in alpha. And I'll speak a little bit about this. This is as a side effect we found of the omniharmonic, in that it increases IQ, basically, because the faster your alpha, the more efficient the brain, and that correlates to changes in IQ. And here he showed that the gains, when you're listening to the sound, continue 5 minutes after you've stopped listening to the sound. This one was really interesting, what Tom sent me. And this shows not only the suppression of that slow frequency, but also an enhancement of fast alpha for this person. This is extremely important for people my age. As we get older, our alpha slows down. And alpha is kind of like a parking frequency in the brain. And you want your alpha as fast as possible, because that's a brain efficiency marker. And what this is showing is that it's suppressing the lower frequencies, which can be problematic for people my age, and it's enhancing the fast alpha. So we use this a lot for folks my age to mitigate the age-related declines. And this is just another one from Tom. We often use these products in school with the permission of teachers of course. And this was a severely hyperactive child who actually wore headsets listening to Omni during the school sessions. And Omni is designed to be played at a very low volume, so even though it was playing in the child's ear, the child could still understand, what the teacher was saying. And here's the teacher's comments that the child connected best with the material and his peers when he was wearing the headphones. Okay, so again, what it's doing is suppressing these slower frequencies. That's what the data from Tom indicated. We can get very precise about this, in which we do what we call harmonic testing, and some of our software does this. It'll test the harmonic to find the most efficacious dose. And here we were concerned about elevated delta, which is a very slow frequency, you recall. Again, here's delta here, about 2 cycles a second. And what we wanted to do was suppress that. Now, this is a person with severe emotional trauma, and often you get a lot of slowing in the front part of the brain, the person trying to numb themselves from feeling the pain associated with the trauma. And what we wanted to do is we wanted to suppress the elevated delta in the front. And you can see it was sitting at about 11 microvolts, and then presenting Omni at about 10% volume, which turns out to be about 40 decibels. It cuts it in half. This is a little louder. It's not as good as the low, and here's a little louder yet. Again, not as good as the very low one, 40 decibels. And we give the people sound level meters to be able to adjust the sound level at home so it's at the most efficacious level.
Thank you, Dr. Swingle. We are now going to address some of your questions. If we don't have time to answer all of the questions, feel free to email them to me after the show. My email address is on the screen. It's rita@swingleclinic.com. Dr. Swingle, you refer to introducing beats to influence the brain. What types of beats do you use?
All of them. We have beats, when the guy pulls up to you in his car next to you at the stoplight and all you hear is boom, 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 boom. You wonder why the guy's not going crazy. Well, if you present that subliminally, you get some interesting effects. So we have the frequency of the sound, what is the tonal quality of it, and then we have how many beats per second. Then we have blended tones. So if you blend 300 hertz and 305 hertz, you're going to get a beat frequency of about 5. So we vary the tonal qualities, that is the frequency of the tone itself, and then we alternate that is manipulate the number of beats, that is the beat frequency of either blended tones or single tones. So there are a lot of ways of doing this. The bottom line is if you're going to do research in that area, you have to have a look specifically at what it's doing to the putative system. And you have to look at the rest of the brain. It's not only affecting the one you're measuring, it's affecting the ones you're not measuring. So when we're doing a research on our products, we do full brain maps and watch what it's doing in the rest of the brain, both on the surface and subcortically.
You mentioned the amount of REM sleep required was fairly short, and as I understand, that's the dream state. You once said that dreaming was the best psychotherapy. If this is the case, what do you think about the work of Carl Jung along with this type of neurotherapy?
Interesting. I've always said that neurotherapy is not a standalone discipline. It marries perfectly with other areas, and that's a very good example of that. You need about 2 hours of REM sleep. REM is for the brain, deep wave is for the body. You need about 1 hour of deep wave sleep for the muscles to recover, toxin exchange, and so forth and so on. You need about 2 hours of REM for the brain to be able to do its filing, that is, file away what you've learned during the day, and secondarily to do its own psychotherapy. Now you can program dream state, and a lot of people have been working with this, but the person has to have a dream state in order to be able to program it. So the marriage of some of the dynamic procedures with the neurotherapy for making the REM state more efficacious makes very good sense to me.
I'm a layman, but I would like to read the guide. Can I?
Sure.
Could you please re-explain the Omni sound?
Omni is a multi-density, multi-frequency product. We have a lot of sounds in there, and they all interact with one another to get subharmonics. It took a lot of research, about 10 years, to develop that product. And the earlier products had only one sound, then the second product had two sounds blending. And the Omni has, in the present state, it has 6. So we use Omni for a lot of reasons above and beyond attention deficit disorders. We find in some cases we have some problems with waveforms associated with sleep, and we find that the Omni harmonic is efficacious. But of course we measure it for the client beforehand to make sure it's affecting the putative process.
And to answer the rest of your question, John, the Omni sound comes in CD version, and we also have it in digital download. Okay, next question. What about long-term effects? Must Omni, for example, be continued forever?
No. Once you get the brain operating efficiently and you are paying attention to exercising your brain, you don't need anything. Now, having said that, a lot of people like to use something to aid their learning. So some people like to have a cup of coffee before they study, and will drink coffee for its caffeine, for example, to maintain being alert. We have a lot of college students who use Omni, not because of any particular difficulty. It just increases the efficacy of the brain. So, that's a question that everybody has to answer for themselves. The answer to your question, though, is once the brain is operating efficiently, no, you don't need something like Omni. The exception to that are age-related declines. What we do with age-related declines is we use whatever products, in particular exercise, to help mitigate the age-related decline, and the consistent use of Omni can be very helpful in that circumstance.
Okay, we have time for one more question, and again, the rest of the questions that we were not able to answer, you can email them to me at rita@swingleclinic.com, and we will email you the answer. The last question is, does the sweep contain the Omni harmonic?
One area of it does, and we have a number of sweep products, by the way, that are under development now for working with a lot of different areas. But the answer to your question is yes, the primary harmonic is Omni.
Thank you.
And speaking of sweep, here it is. Areas like depression are associated with the balance of these two areas. F4 is the right prefrontal cortex, F3 is the left prefrontal orbital cortex. And how these interact is strongly related to issues like depression. And this is why when we were dealing with athletes who have head injuries, we have problems with mood regulation. That's because it's influencing the frontal cortex in terms of how the frontal cortex, the two areas, are talking to one another. This is just some printouts of individuals with various forms of depression. And it's very identifiable using my clinical cue, intake assessment, EEG. Here we have a situation in which a person has the marker for what we call genetic depression, in which the right side of the brain has more beta amplitude than the left. Here's reactive depression. Somebody dies, for example. And here we're getting slow frequency, more slow frequency in the left relative to the right, and it can be either an alpha or theta. Here we have the similar situation with theta, another slow wave. Here we have a trauma in which we can measure when an individual has been exposed to a severe emotional trauma. And we all have predispositions for all kinds of things, and trauma very often will manifest a genetic depression, and that's what we have here. So we know exactly what it is we're trying to do with an individual based on the brain activity. Now, this is just an indicator of what sweep will do. This is before treatment, and you see that we have some mild disparities between the right and left side of the brain. In particular, this person has a mild form of reactive depression, in which the left has excessive amount of slow frequency amplitude. After a 15-minute exposure to the sweep harmonic, you can see nicely balanced. And the percent change, is quite substantial. So that's what this product does, and we use it a lot for issues like depression. Excuse me. Mozart is a wave form that's designed to increase the sensory motor rhythm, and in most cases it does not affect the theta amplitude. It's a product we have to watch carefully when we're treating something like epilepsy, for example. And this is an epileptic in which we're trying to reduce the theta SMR ratio, increase what's called the sensory motor rhythm in the brain, which helps with reducing seizure threshold. And you can see we get about a 15% improvement in that condition with the Mozart harmonic. And again, we test it to make sure that what it's doing for the client is what we want done. So here we're looking at the low-high alpha. Now that's the one associated with intelligence, if you remember, or brain efficiency. And here's the alpha. And what we want to do is we want to increase alpha, but we only want to increase good alpha. So here's at baseline. Here's at 38 dB, where we're getting a mild improvement in alpha, but a very nice improvement in the balance. So the brain's becoming more efficient. Now, at higher levels, we're getting, again, some improvement in the alpha. It's not affecting the low-high alpha negatively too much, but here's the one we want. And this is at 50 decibels, and we have a nice jump in alpha and a nice balancing of the brain efficiency marker. So we can be very, very precise in terms of how we prescribe these products. It's not take 2 of these and call me in 2 weeks to see if anything's happening. We know it precisely how it's affecting the putative process. Serene is designed to suppress beta. Now, there are conditions in which you have too much beta in areas of the brain associated with severe anxiety conditions. And here we have beta tested at, again, the center part of the brain, the front of the brain, the back of the brain. And in all cases, we're getting a nice reduction in beta. It's a little low for this client at FZ, 19-year-old male. And it's not very high here. It's only about 6%, but we know exactly how efficacious it is. We also have stimulate acupuncture points. This is pericardium 6 right here, and you can stimulate that electrically. And what that does is it enhances theta, so it can be used to quiet in areas of anxiety and in some forms of depression. if you look at the topographic expression of anxiety and depression, often you find this. And here we have the form of depression in which you have a lot of slow frequency over on the left front side of the brain. Those were the two that I showed you, reactive depression, and excessive amount of beta in the back part of the brain. That's what we were just looking at for the serene would treat this, and sweep would treat that. Sleep. This is a situation in which it took a person an hour and 19 minutes to fall asleep, okay? And this is when they used the omniharmonic, cut it down to about a half hour to fall asleep. Here's another one. Sleep onset was 22 minutes. Sleep onset dropped substantially, but more importantly, this individual had an hour and 40 minutes of REM. That's probably okay. I'd like it a little higher, up around 2 hours, and only 36 minutes of deep. But with harmonic sleep, 2 hours of REM, 1 hour of deep. Bang on. Exactly what we want. Nice sleep onset. Sleeping too much. Want to cut them down to about 7.5 hours. And the harmonic sleep compared with, now here's our horse race between Zopiclone, a Z-med for sleep, and harmonic sleep, and reduction in sleep onset for a severe onset in insomnia person, 22-minute reduction with Zopiclone, 17 minutes with our harmonic sleep. But there are no hangover effects. Zopiclone can be a very serious problem with slowing of brain activity, particularly with the aged. What happens if a person is medicated? And just look at what we're able to do in terms of suppression of beta in treatment with an individual who's not medicated. Here's a person who's medicated, doesn't move. So those are the side effects associated with using medication. The reason it works is it flattens out brain activity. You get an unresponsive brain. And a lot of the devices we use for this, here's the cranial stimulator, and this is the one that you put on your earlobes, turn it up to where you can just feel it, and then just slightly below that, so it's subliminal in nature. And that's been FDA approved for mood, anxiety, and sleep. And what it does is it helps with increasing slow frequency in the back of the brain. And light therapy has been found to be as effective as an antidepressant for depression, including severe depression. There are a lot of different ways of getting light. The best is go outside and look up at the morning light, and you want your light early in the morning. That's when light therapy is most efficacious. And the product we use is referred to as Spectra, in which you have the lights around the periphery of glasses, and you put them on before you get up in the morning and leave them on for an hour or so while you're getting ready for work or school. Optima is a harmonic with some subliminal statements associated with feeling good, feeling secure, and so forth. And here we had a sham procedure in which we had music with and without Optima. Now, Optima's at subliminal level, so you can't tell whether you're playing music with it or without it. And you get much higher ratings of happier with individuals who use the Optima as opposed to those who didn't. And these are people without depression now. And the more sad the individual, the greater efficacy of Optima. So these are individuals with varying degrees of depressed mood state. My favorite product, and this is following Grandma's advice, get your duff off the sofa. Okay? And all you do is wear this, and an active person is 10,000 steps a day or more. An inactive person is under 5,000. It's a perfect feedback device. You put it on in the morning, and at night before you get into bed, you take it off and record it. and you just slowly move yourself up to higher degrees of activity. And that's not a trivial matter. Slow walkers die earlier, bottom line. So walking can have very, very major beneficial effects as an exercise, not only for we old guys, but also everybody. So why are you using a supplement? Why are you using a home treatment? And we have treatment that we just indicated. And with treatment, you want to make sure you're affecting the putative mechanism. Make sure it's doing what you think it should be doing in terms of what's causing the problem. Maintenance, we use harmonics and our other products a lot for maintenance. If we have an individual who's been depressed because of an imbalance in the front part of the brain, then when they go home after treatment, they use either the sweep harmonic or the spectre glasses, which also has a sweep property, so we can maintain the gains they've made in treatment. Prevention, lots of things associated with prevention. Now that's why people are taking all of these supplements to prevent something from happening. Best prevention in the world is get your duff off the sofa and stop eating potato chips. Functional aid, you want to go and, you're a college student, you want to be able to push yourself in terms of being able to study for longer periods of time, Omni can help. And a spa, you just want to feel good, okay? Nothing wrong with that. So why, somebody asked about meditation. A lot of people use Serene while they're meditating just to get themselves into a very good spot. Nothing wrong with that.
Very informative. Thank you, Dr. Swingle. I will now conclude the show with a few announcements. First of all, for those of you who are interested in learning about neurotherapy, this book is a great resource. It is called Biofeedback for the Brain. Dr. Paul Swingle is the author, and as we like to say, this is the most important book you'll ever read for yourself, your children, and grandchildren. It is available at soundhealthproducts.com. The Clinician's Guide is a literature for the therapists. The book leads them through the procedures for evaluating and treating patients with a wide range of disorders. It is also available online at soundhealthproducts.com. Our next fundamental neurotherapy workshop is scheduled for May 23rd. It is a 3-day workshop, and 1 day out of the 3 is specifically dedicated to intensive hands-on training. Participants will be instructed on every aspect of the setup, recording, and treatment phases so that they can apply the assessment and treatment procedures in their practices. The advanced neurotherapy workshop will follow from October 24th to 26th. We have more information on both workshops on our website at swingleclinic.com, and you can also email me with your inquiries at rita@swingleclinic.com. These are some of the future topics for this year's webcast. We will be discussing addictions, learning and attention disorders, anxiety, depression, emotional trauma, and more. All of these webcasts with different topics have been scheduled on our events page at swingleclinic.com. So if you are interested in listening to any of these live, you can register now at our events page, and again that is swingleclinic.com. Well, now you know about Sound Health products, but if you would like to get more information about these products, you can visit the website at soundhealthproducts.com. And this is the end of today's episode. It is all in your head. It was great having you all, and we certainly hope you enjoyed the show. We will be back live on March 15th, and it will be Dr. Mari Swingle discussing the internet addiction. Have a great weekend, everyone. Bye-bye.